All right, well, we'll go ahead and get started. Good afternoon, everyone, or good morning, depending on where you're joining from. Thank you all for joining us today. My name is Laurel Rodriguez, and I'm the Director of Marketing at Sure Impact. And our topic for the webinar today is Proving Impact, How Evaluation Unleashes Powerful Interventions. And I'm really excited. We have a guest presenter today. Mara Trionfero Lucas is a project development associate at Leo, and that is um, where did I put it on here? The Wilson Sheehan Labs for Economic Innovation. Is it? No, I think
Opportunities.
Opportunities. That's what it is. Yep. It's a really cool program that they have going there, and she's going to talk a lot about that today. As a project development associate, Mara works on the strategic partnership team to identify partners ready for rigorous research with Leo. She worked in the Student Health and Wellness Unit in the Division of Student Affairs at Notre Dame with an emphasis on substance use risk reduction for 15 years. She received her BA in History from Lemoyne College in Syracuse, New York, and her Master's of Science in Social Work with a specialization in Child and Family Studies and School Social Work from the University of Wisconsin-Madison. So, um, we will go ahead and get started. I'll turn the time over to Mara. I do have just one quick question, though. Would you prefer if people make questions as you go, or would you prefer that we kind of save them till the end?
Let's try questions as we go.
Okay.
It's a nice small group, so I think we'll be able to do that.
Okay. That sounds great. All right. Well, I'll go ahead and turn it over to you.
Wonderful. Thank you. Well, it's great to meet you all today. Thank you for being here. Let me just get my slides ready to go. I don't know where y'all are, but in upstate, I call it upstate Indiana, we are supposed to hit 90 today. So that is after a low of 40 the other day. So we are very excited about that. I am from upstate New York, so the weather has always been a very defining feature in our well-being. But now I am at Leo, the Lab for Economic Opportunities here at Notre Dame. And we are an academic research center that focuses on addressing poverty and economic inequality through evidence-based approaches. So Leo lives within the econ department, created about 12-ish years ago by two economists who were doing some great research that no one was reading. It was just kind of being shelved in journals, and other economists were looking at it. But they wanted to bring together the providers, social service agencies, policy funding decision makers to really de-silo some of these efforts and using evidence to connect the dots to have a bigger impact in the community. So we collaborate with organizations, policymakers, practitioners, networks, all sorts of people in that poverty realm to really evaluate the social programs and interventions aimed at keeping people out of poverty or preventing people from getting there. So we have had the opportunity to get to know Sure Impact over the last few months, and we know that they help you collect some really valuable data points, and we want to help you to take it a step further to use some rigorous research to tell a story with them. I heard a provider say she was at a presentation that said, uh, stories without data are fiction. And so she worked with us to try to fill in the depth of the story of her organization. At Leo, we believe that poverty can be outsmarted with all of us kind of directing our energies at what we know works. Broad communities of big thinkers across sectors can really come together to get the tools and to maximize the impact and synergy between them. We know that the social service community is already doing invaluable anti-poverty work, and our goal really is to walk alongside organizations to identify and amplify what we know is working. We know that evidence is critical, as I just mentioned. It lights the path to learning what works. And most importantly, and this is tied very deeply, not just in Leo's mission, but in Notre Dame's mission, people living in poverty deserve interventions that work. Human dignity is at the core of the work that we do. And ultimately, why we want to help you is so you can better help others. So we exist because there are a lot of people in poverty and the government spends a lot of money, but we're not often connecting the dots between the two. And so we want to help organizations to prove their impact and then impact policy makers and funding decision makers to point funds in the areas that we know will work. So, what do? We find the innovators, many of you, many organizations that you know and love as well. We teach about impact evaluations. And so, really kind of have a boot camp where you're learning all the ins and outs of this if you're part of our cohort and really helping you to think through the questions that you want to ask and how we can get at the answers. We do this mostly through randomized control trials, and we'll talk about that in a minute. But we work with our partners to really overlay the research design on your program. So this is really a collaborative process. We see this as a partnership rather than us kind of imposing our agenda on organizations. So we really want to, again, to answer the questions that you have and to work together. We have some research muscle that we bring to the table. Sure, Impact has some data and some technical impact that they bring to the table, and you all have the knowledge of your communities and the work that you do. So we really want to think about how we can maximize those strengths together. And then we learn and we iterate and we share and we scale and we create change, and ultimately we solve poverty. So currently, I think we're at 110. We just welcomed in a new cohort, but we've performed research with over 100 projects. We work domestically in the US, and so we are across at least 29 states. Some organizations have multi-state sites, but we just count the home base, and we are at 15 cohorts. So our cohorts are time-based, not kind of subject area based. Our goal, so we've had 100 over the last 13 years, I think, is to get the next 100 in half the time. So we're looking to really build that body of evidence that is going to help us to have some impact on some of these issues. So I know that many of you are already bought in on research. Maybe you're figuring out where you are in the readiness. And so I want to think a little bit about some of the case studies, but also just kind of frame them with some information that we think about in terms of the specific kind of research we do. So, a lot of situation organizations are developing and then reporting back in terms of outcomes. And at Leo, our goal is to go further than the outcomes, to really think about impact, and then take that a step further to go to dissemination. And that's something that I think is really unique about Leo is that the policy and impact team comes alongside you while you're still in the research phase to really think about what you want to do with these results. Is it get more funding? Is it policy change? Is it replication? Is it scaling? Manualizing the work that you're doing? So our partnership doesn't end at sharing the results with you. It continues in some cases for years. And I'm a visual learner, so I think this is a really great way to think about. We have the outputs of the organization that we're collecting data and we're evaluating the work that we're doing. And then we have the outcomes of the specific programs, the effectiveness of the service offered, how many we're serving, breaking down some of those pieces, who's finishing. And then we're trying to hone in on that impact evaluation where it's the intervention that's being rigorously tested to affect the impact on the people, whether they're intended or unintended. And so when we think about the impact evaluations, and we'll talk about this again in a minute in a different form, but we want to think about what questions we have, and then how do we measure that? Can we scientifically measure? Oftentimes we're trying to use administrative data from the state, county, federal government, so that we can compare with those who are not being served by our program. And then to get that statistical significance, we need a good number of people. And so if we are able to put those things together, we can trace, we can track people who are going through our programs and then show the impact, kind of canceling out all the noise of the different variables that may be in their experiences. Again, I'm a visual learner, so this just gives you an idea of how we work, the life cycle of Leo. We are connecting right now, and we like to learn about organizations, but also teach you about us. We have a pretty rigorous vetting process so that we make sure that this really is a good fit for the long-term relationship that research will culminate in. And again, the big part that I think is important is not only are we discovering the results, but then we're disseminating, we're helping you to think through that. So I want to give some concrete examples of what this has looked like. And I'm going to talk real fast so we can do two. But first, I want to dive into Stay the Course. Stay the Course is an intervention that takes place in the context of a community college. The case for the why of community college is pretty compelling. We know that it's 64% less expensive than in-state tuition for a public four-year school. And adults with associate's degrees often earn on average $9,000 more per year than adults with only a high school diploma. So, Stay the Course exists because nationally there appears to be a crisis when it comes to persistence and completion. And we know this is especially true for low income students in those community college programs. So, they have access to and are able to enroll in the community college, but often don't complete and have the challenges that comes with that. So if you look at students who enroll in a community college, um, 6 years after that enrollment, less than 40 people have a degree, and you can see that breakdown between the 4 year and the 2 year. And that means that almost 61 have not gotten a degree. So that 61% of those people who enrolled in school likely incurred some debt, have potentially made changes in their lives, but they're going to forego all the economic benefits that might come from that. So, Catholic Charities Fort Worth saw this problem and they created Stay the Course, which is a comprehensive program that addresses the personal, non-academic, social, and institutional barriers that prevent students from successfully completing these programs. So, it's two main components: comprehensive case management and emergency financial assistance. So, the program was designed to be strengths-based, customizable, holistic, and long-term. And so, we worked with them to study the impact of the program. They identified students who were eligible for the program. As you can imagine, there were many more students who were eligible and in need of this assistance than Catholic Charities Fort Worth was able to serve at that time. So they randomly assigned some to be part of Stay the Course and some to be part of a control group. And the control group had access to the resources that the community service was offering, community college was offering to everyone. So what did we learn? You'll see on this slide two charts. The blue bar represents those who went through Stay the Course, and the yellow is the control group, students who didn't participate but could have taken advantage of other community resources. And if we look at persistence, how many were still enrolled? Almost 50% of the treatment group, the blue bar, were still enrolled after 6 semesters, compared to about 24% of the control group. So that's 25 percentage point increase in persistence. Now, if we look at completion, we can see the difference between 19% of those who did stay the course and just about 3% of those who did not. So that means that we increased that, or they increased that completion rate by a factor of 6. So something that's interesting, if you remember when we were framing the problem up at the beginning, at the national level, only 40% of community college students get a degree. And if you look at Stay the Course, you see 19%. And if you only have those two numbers, you might think that Stay the Course doesn't work. It can't even beat the national average. But I want us to remember that the students who are being served through Stay the Course are not the national average. These are the students who have the most needs. And so being able to have that control group to compare really helps to demonstrate that growth and that impact. So, what did Catholic Charities Fort Worth do in partnership with Leo with these results? First, they raised a lot of money. to support the program so that they were able to serve the people previously they may have said no to. They expanded from one campus to providing the program at all five community college campuses and were able to serve thousands more students. The Joyce Foundation connected Leo with the Institute for College Access and Success, which is a think tank advocacy organization. And so together they set goals to advance this evidence-based program to improve college completion for low-income students. And they've had successful experiences with securing federal resources to support student grants. And so the wins started as small, but you can see that they've continued to expand. And the research contributed significantly to this conversation because we could put data behind the anecdotes. So this was really exciting. To give you another example, we found that Catholic Charities Fort Worth got the bug. They got the research bug. And so they came back to run another study on the impact of their Padua program. So, Padua is a holistic case management program really designed to address the unique assortment of barriers faced by families in poverty. And so I want to consider Rosa and Rosa's story. She's a single mom. She has three children and never finished high school. She would like to work, but didn't have a car or have access to public transportation. In addition, she fell behind on rent and received a eviction notice. So we can start to identify some possible next steps for Rosa to move out of poverty, get the credentials for the job, find childcare, address transportation, check, 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 right? We could go through this in a check-boxing way. But her forward progress really isn't as simple as that because there's other factors that make this challenging for Rosa, and Padua really gets to the meat of the matter in working with those individuals to figure out those barriers. So this case managers provide individualized services that address each family's unique barriers and begins with that individualized assessment and case plan, addressing basic needs as a first step. They have small caseloads for staff and they serve as both connectors and coaches. And they have the ability to serve clients really for the long haul to achieve that economic mobility. And so Padua is designed to support participants to get jobs, reduce dependency on government, and accumulate savings, reducing bad debt. So for Rosa, this means getting stable housing first, and then her case manager might provide financial assistance to buy a car. Her child had special ed needs, and so referrals to tutoring to support that child, and a plan to get the necessary credentials to secure the employment. All the while, the case manager is really supporting her in getting those steps met through that journey. So they participated with Leo in a randomized control trial. So we learned that Padua resulted in a sharp increase in full-time work for those who participated. 2 years after the study ended, after the random assignment, those who were assigned to Padua program were 25% greater than those. The employment rates were greater than those for the control group, and the effect is much larger and more persistent than job training programs because of that intensive case management. And if you dig into the details and look at the subsets of people who were unemployed when they entered the study, those individuals earned 46% more than those who didn't go through Padua. So there was increases in stability, declines in credit card debt. And one of the things that we noticed was there was almost like a J curve when you looked at the results, because in the first several months, you might actually want to see an increase in benefit utilization as clients are getting to work with our case managers to stabilize. And then over time, you see that decline. So again, what did Leo do with Catholic Charities Fort Worth to leverage those results? And so in addition to understanding and improving programming, figuring out who this works for so that they could really tailor it, they use these results to advocate for more holistic, long-term intensive case management services. And so our managing director testified before the House Ways and Means Subcommittee and really looked at the Texas legislature opportunities as well. And they're actually participating in our first replication and scale cohort. So this is part of Leo's long-term goal of putting that evidence to use. So once we find something that is successful, how do we help scale where appropriate, replicate where appropriate, and ultimately shout it from the rooftops to affect policy and philanthropy? So we're using best practices from the for-profit franchising world and applying them to the nonprofit sector. And we have some great partners working with us on that. Padua is packaging the program and they're building out a national kind of office to do so, all because we can see that this works. All right, so what could this opportunity mean for many of you? I want to start about by thinking about some of the synergies that we're looking for. We are looking for the right partner. And so the right partner really shares that value of believing in the people that they serve. So we want the programs to reflect and be informed by the lived realities of the service recipients and really seeing the clients or your neighbors or your partners in the work that you do as people of strength and gifting, not just check boxes or case notes. We're looking for organizations with stable and committed leadership. So the leadership team really is there to build the culture around the research, to help understand why we are doing this. We want them to be adaptable and creative and really rallying the troops, the organization, frontline workers, so that we're all rowing the ship in the same direction to get towards those positive results. And being willing to assign people on the team to work on this and prioritize this. In addition, we hope that they stick around. So when there's a change in leadership, that can be a really challenging time to do research as priorities may change and consistency may be challenging. We're looking for organizations with grit. So, as I mentioned, this can become challenging at times. As we go through the research design, enrollment, outcome measurements, and dissemination project processes, we want to make sure that, again, this is a priority and that we're able to pivot when needs to be pivoted and just continuing to communicate if things do become challenging. And then ultimately, we are looking for an organization that is nurturing that culture of learning. So comfortable with strangers from Notre Dame kind of looking behind the curtain to see how things are going and really determined to understand what works and why. And I think this goes back to number one, because we believe in the people we serve, we want to learn and to grow and to maximize the work that we're doing. And so, one organization that we worked with, Goodwill Excel Center, we had some great success in determining that the work they were doing to get adults high school diplomas was more beneficial. I think there was 38% increase in earnings over typical GED programs here in Indiana. And so they were working on scaling, they're working on getting more funding, expanding this program. But wait, there's more. And so as the researchers dug in, they found that the potential barriers of individuals with criminal justice experience that had been in the criminal justice system, they weren't experiencing the same benefits as others in the study. And so that was an opportunity to kind of take a step back. The Goodwill Excel Center took that information. They created a new kind of intervention to think about how to support those people, and now they're doing another study. So that is one example of kind of a great partner in taking what we give them and working on that. So the other piece is we're looking for organizations that have well-defined interventions. So it's something where you can say, this is who receives it, this is how they get in the program, this is what the program looks like. It's fully funded so that, again, we can be consistent over time. We're looking to advance collective learning and really contribute to existing research. So we want to advance the field and specifically kind of the subfields that y'all are working in. We want to incorporate research design into day-to-day operations. So again, not changing the way you do your work, but kind of overlaying. And that might mean incorporating research design and enrollment procedures or thinking about how we sign people up. We want to be able to define what the outcomes are going to be. So, what are we measuring? I know that I was talking to an organization who wanted to measure long-term recovery. Well, that's a really hard thing to objectively say. Um, People have different definitions of recovery. How do we track that beyond self-report? How do we track that for a control group and a treatment group? And ultimately, we were thinking about, okay, if we're looking at job and we're looking at earnings and we're looking at criminal justice involvement and we're looking at potential hospital use or medical care, then we could probably make some assumptions about people in their long-term recovery if we can see the progress that they're making in that way. So we have to find something that's measurable and then using that comparison group. And there's a lot of different ways to think about that piece. So that was a lot of information. And I wanted to just kind of show what this, again, a different version of this life cycle with Leo. And so, again, my role is to find organizations who are interested, who have questions, who potentially may not be ready, but help you to get ready to think about some of these things. And that is kind of that project development role. We have a process that, again, is meant to be rigorous to help ensure that all of us are prepared to make those steps forward. And then we have a research operations team that is helping you to design the study and helping to think through what this means, again, on the ground for all of your staff and training all of the staff and thinking about some of those pieces. And then ultimately, again, as I mentioned, that policy and impact team is going to get involved. And so I just want to think about if this is something you're curious about, something you're interested in, what the next steps may be. We're looking to help build out the cohort for 2026. And again, thinking about that fight against poverty in kind of a big picture way where we're offering services or we're studying services in homelessness, economic mobility, employment and job training, housing and homelessness, interventions and prevention, health, education, strengthening families so that we can help work on kind of breaking those cycles of generational poverty, and then ultimately criminal justice. And what's not listed here is also recovery. So here is my information, and I did talk really fast, so I am gonna pull the slides down, see what questions we have, and then pull up some really short videos so you can hear from one of our providers. So I'm gonna stop the share so I can see you all and see what questions people have, how I can help you think through this.
All right, well, thank you so much, Mara. For anyone that has a question, feel free to unmute yourself. One of the questions that I had was just so if the people on the call are interested in working with Leo, maybe they're not ready yet, but they would like to, what are some things they could do to start getting their organizations ready to work with Leo?
Yeah, I think working with you all is a great step in kind of thinking about data and how we collect data and what we're measuring internally. Another area that we think about is making sure that the organization really does have a consistent model of treatment. So maybe you have 3 sites, and depending on who works at the site is how the checklist kind of goes. And so tightening up some of those pieces for consistency. I would say potentially thinking about numbers. So one of the greatest challenges is hitting that statistical significance. So we're looking for programs that might have a couple hundred people in them. So thinking about what are ways, if you're interested in this, that you can serve more people, get in front of more people. And then ultimately, it's again that culture of learning, starting to ask each other, like, we're making these assumptions about the work that we're doing, and we're hearing these anecdotes. What might we want to know? And so thinking about some of those pieces, I know that happens a lot in strategic planning. This is what we think we're doing. We have a beautiful theory of change. We have a beautiful logic model. What questions do we need to ask to ensure that we're hitting the mark?
Okay, thank you.
No other questions right now. I can introduce you to our friend Betsy, and maybe that will stimulate some more questions so you can hear. Oh, cost structure. I always forget this. I am so sorry. It's free. I need to put that in my slides. So we pay for all of the research costs, and we ask for organizations to cover the costs of delivering the program. So we are fully funded on our side. There's no charge for research, and again, those other pieces that I mentioned, the impact pieces, those are part of our operating budget as well. So there is no cost. I forgot to mention that. I'm so sorry. All right, I'm gonna share again real quick and just show you our friend Betsy. I think I did it right.
I can see your screen.
Yep, the wrong screen. Sorry. Let's try again. All right, now do we have the right screen?
Yes.
So I was at this great talk about 2 weeks ago, and it was a gentleman talking about storytelling and how compelling that can be to people to want to invest in what you do or to want to, like us, see families thrive. And he was talking about narrative and those kinds of things. And then we started going into this data conversation. And someone said, well, where does data play in all of this? What's important about, with data, with storytelling? And he said something I'll never forget. He said, a story without data is fiction. And so as a nonprofit, you want to be out there speaking truth and really saying, we do this for this family, but we do it for thousands of families. We will use the evidence to first really take a close look and microscope to the model and make sure that, it is working for families, and that the investment of their time and their energy in their education is paying off in the way that it's supposed to. We will use it in our state, in Indiana, with our General Assembly, to continue to go back and say, for this investment that you're making as a state, this is how these families are doing. This is what they're doing with coming off public assistance. This is the increase in taxes that they are paying. And this is how their families, thousands of families are doing. And so far we've seen this steady increase in income, and we're going to continue, hopefully, to see that. We will use it for our national partners. We just had a whole contingency of legislators from Arizona come to visit because they want to open an Excel Center in Arizona, and their governor and their legislator want to make that investment. And so the most compelling piece of our story is what's happening to our graduates. Where are they? How are they doing? And that data, that research really tells that story well. So they come and they meet our students, and they come and they meet our staff, and they tour our school, et cetera. And those are all wonderful pieces because they see, and it's physical to them. But if you want to get a long-term, really deep picture of an organization and how they're doing, you really need to look at their evidence and their research.
So that was the Goodwill Excel Center before they started their research. I referenced them earlier, and kind of asking, what are you hoping to get out of this? And so fast forward.
So I was at this great talk.
So survival is one. What else do we have?
Approximately 18 million adults in the United States don't have a high school diploma, severely limiting their economic opportunities.
Many state laws prohibit those over the age of 21 from going back to school and getting their high school diploma.
What do we need to do?
Historically, the only option for these students was the GED. But statistically, the high school diploma leads to greater opportunities. We knew we needed to do something to change these policies.
Goodwill founded the first Excel Center in Indiana in 2010 to offer free, high-quality high school education for adults over 18. They partnered with the University of Notre Dame's Lab for Economic Opportunity to conduct extensive research on the success of the students.
Our research shows that graduates from the Goodwill Excel Center see a 40% increase in their earnings roughly 5 years after they first applied. We expect their earnings to be meaningfully higher for the rest of their career, and it may even positively impact future generations.
We've helped pass legislation in 12 states, and Notre Dame's research is key in convincing legislators that the funding is worth it.
When we invested $12 million in Arizona's first Goodwill Excel Center, Notre Dame's work showed us it was the right decision, and we changed Arizonans' lives for the better.
I want my kids to be proud of me. I want my family to be proud of me.
Arizona is just one example of Goodwill's growing impact.
Our goal is to expand the Goodwill Excel Center to all 50 states. And with Leo's support, we can continue to improve the lives of our students and their families.
The University of Notre Dame asks, what would you fight for?
Fighting to improve education policies.
We are the Fighting Irish.
So that just gives another perspective. Again, you do not have to be as ambitious as the Goodwill Excel Center and want to be in every state in the country. We really just want to meet organizations where they're at to help them to find the answers that they're looking for. And so that first step, maybe will you put some links in the chat, is to have a 20-minute conversation. It's no pressure. My background is in social work, so I am not going to throw all the economics lingo at you in that first call, but just to learn about what you're interested in and what you might potentially want to ask, what you want to learn. And if even if you don't think you're at that point yet, I can help you think through what some next steps might be. I do want to just end on a funny story. So I have seen those videos of Betsy many times, and I was at a Notre Dame football game. It was winter. We were bundled up. We were in the restroom, and I saw Betsy, and I said, "Oh, hi! It's so good to see you." Betsy has never met me, but I just saw that video so many times. I felt like I knew her, and so I had to like take a step back from harassing this woman in the football game bathroom to identify myself as a Leo staff member, and I'm trying to convince her to start her third project. So again, there's always more questions to ask as we think about just refining our model ultimately, so we can just serve our neighbors in the best way humanly possible and potentially help stem the tide that we're seeing with poverty. So thank you. If you have more questions, please feel free to throw them in the chat.
Just while we're waiting to see if anyone else has questions, I will be sending out the recording. And Mara, can you send me your slides from the presentation?
Absolutely.
And then we'll also make sure to share the Partner with Leo link um, as a follow-up in case anyone else has more questions, wants to reach out. Well, it looks like we're going to go ahead and give everyone a few minutes back today. We thank everyone for being here, especially Mara. Thank you so much for sharing your time and for your team that's here. You do great work. We're excited to partner with you, and
Yeah, we're excited as well. And thank you all for the great work that you're doing. Again, we are kind of sitting in the academic sphere, and we know that y'all are doing the hard work.
all right. Well, thank you, everyone. I hope we have a great day, and we'll be following up soon.